Imagine you're going to the doctor's office for a routine visit and they say that they need to draw your blood. In this moment, most people experience a range of emotions from curiosity to nervousness. However, blood draws are one of the most common and most important procedures performed in the medical field. Doctors use them to detect disease, monitor conditions, and they ultimately use them to maintain healthy patients. Therefore, today I'm going to be demonstrating how this process works by focusing on 3 main steps, and that is preparing all the necessary materials, collecting the blood, and then caring for the patient afterwards. Before anything is done, the most important and first step is to ensure that all of your materials are laid out and that they are easily accessible to you during the procedure. Preparation is essential because it ensures that you are organized, efficient, and it ultimately ensures safety for both the patient and the healthcare worker. Trained professionals will lay out all of their materials, such as their gloves, their gauze, their tourniquets, collection tubes, and anything they might need during this procedure. Everything has a specific task that it must perform, and to ensure that the whole process is done safely and accurately. And so the Arizona College of Nursing says to take your time to understand each of the phlebotomy equipment that you're going to use. And this is, of course, to provide the utmost safety in the whole situation. And so more preparation may include double checking labels, patient history, or other equipment. And this is to ensure that there are no mistakes. Because the smallest labeling mistake can lead to a major medical error later on. And so we wanted to reduce the risks of all mistakes. And so that's why you should be prepared and lay out everything that you might need during this process and to ensure that everything works. The next step of this process is, of course, to collect the blood. This is the part that most people think about, but in reality, it only takes a few seconds. And so first, you're going to sit your patient down in a comfortable position, and then you're going to position their arm where it's accessible to you. Then a tourniquet is placed on the upper arm to make the vein more visible. And this is to create the most optimal spot for you to draw the blood. The site is then cleaned to prevent or reduce the risk of infection, really, and then a small needle is used and inserted into the skin to collect the blood. This only takes a few minutes and most people only feel a pinch. Once the sample has been successfully collected, the process isn't over. After the needle is removed, pressure is applied to the site and then your needle is properly disposed of. The tourniquet is then removed and then a bandage is placed over to apply more pressure to the area, and that is to reduce the bleeding, reduce swelling, and to ultimately begin the healing process. It is also very important during this time to check on the patient and to see how they feel, because during this time, most people can feel lightheaded or dizzy, and so it's important to check on the patient and make sure that they're comfortable and that they're doing okay. Another very essential step to prevent contamination and to protect all healthcare workers and patients involved is to properly dispose of all your equipment and to make sure your needles and your collection kits go in their designated biohazard bins. Of course, again, this is to limit the exposure to harmful bacteria and substances that you don't want to deal with, of course. And so the National Institute of Health says to assume that every biological specimen is infected and to handle them as so. And so, again, make sure all your materials are properly disposed of. So in conclusion, drawing blood may seem like a simple or even intimidating task, but it actually involves steps to ensure that safety and accuracy during the procedure. From preparing all of the materials to collecting the blood to caring for the patient afterwards, all of these steps are essential in performing this task. And understanding how this procedure works help people feel less intimidated, and to show them how precision and even the most routine medical tasks can be performed correctly and safety. And so the next time that you go to have your blood drawn, I hope this has helped you to better understand how and why this process works, and hopefully that'll make you less intimidated. And so thank you for your time.